Well, hello out there. It's Mrs. Coli. I hope you're having a great day. Today I'm going to be talking to you a little bit about obsessive compulsive disorder with the hopes that I might be able to enlighten you a little bit more in regards to this topic. I won't necessarily be visiting with you as a professional educator at an elementary school setting, but I'll be visiting with you more as the social worker and the psychologist that I was years ago in the mental health field. So today I wanted to share with you a topic that I feel like that might be affecting we as Americans and citizens from other countries as we deal with the fear associated with COVID-19. And with obsessive compulsive disorder, there are trigger points that kind of make our obsessive compulsive disorder maybe more severe in nature. And so I thought I would share this information with the hopes that it might help us to better understand this common, chronic, and long-lasting problem. So I could educate you, you could educate others, and we as a whole can be better prepared to help our dear friends, our neighbors, our loved ones, those family members that maybe are dealing with this at this time and maybe in the future in their lives. I wanted to share some quick demographics with you. You can look over this at your leisure, but basically what it's showing is that women tend to have OCD more than men. So as you can see, these are just the general public that deals with obsessive compulsive symptoms, the fears that we all have. You can see, yes, women tend to have more fears than men in general, and this is with the actual diagnosis. 2 to 3% of these individuals have to deal with it for the entire their lifetime. It says there really isn't too much of a gender difference. Typically begins at age 10 when it's diagnosed, or it's diagnosed between 18 and 30. It's less common among African Americans and Mexican Americans and more common in divorced, separated, or unemployed people. So I wanted to provide you with some background knowledge, and now we're going to study obsessive compulsive disorder more together. And I hope that this is a topic that will benefit you and provide you maybe with some relief also. I enjoy sharing this with you. Let's learn a little bit about what is OCD. So this will be an ongoing lesson, and our focus right now is what is it? Well, it usually doesn't happen all at once. The symptoms start out small, and they can seem normal. Like a lot of us joke that we have OCD. Like for me, maybe I like to wash my hands a lot, especially with COVID-19 issues, or I like to have order. I like to have things organized. And everybody has those quirky things, or they're paranoid. They have to go lock the door 5 times before they go to bed. These are all of our quirky OCD issues. But at some point, there might be a trigger that is brought on by a personal crisis or abuse or something negative that affects you a lot, like maybe the death of a loved one. Or people with OCD, they typically have family members with mental health disorders, such as depression and anxiety. And so they're maybe more predisposed to this condition. So OCD symptoms include obsessions, or they might be compulsions, or they might be both, like a typical obsessive compulsive disorder where you struggle not only with the thoughts, but the compulsions, which are like rituals where you have to keep doing things over and over again. An obsession is an uncontrollable thought or fear that causes stress, whereas a compulsion is a ritual or an action that someone repeats a lot. Compulsions may offer some relief, but only for a short time. I'm going to share with you an extreme version of individuals dealing with OCD. And this story came to light maybe 4 years ago, and it was a pair of twins that were about 33 years of age that had dealt with obsessive compulsive disorder their entire lives. And these 33-year-old twins, Sarah and Amanda it looks like Eldridge, were from Broomsville, Colorado. Well, it's a tragic story where they finally gave up. They couldn't take it anymore. That this is not the end all, that this is the beginning, because it all starts with education. Well, hello again. It's Mrs. Coli. I wanted to share with you a little bit more information about obsessive compulsive disorder awareness. And this is a great analogy that I found, and it's thinking of your anxiety as an alarm system. And think about, if your alarm goes off, what does that mean? Maybe on your house, maybe you have a camera located somewhere on the exterior of your home, and if the alarm goes off, it definitely alerts you. That's its job. It gets your attention that possibly an intruder is trying to break in, and it wakes you up. It gets you out of bed. It helps you to be prepared for whatever, whatever situation you're in store for. But what if the alarm went off because, in this case, a bird landed on the roof instead, and it triggered your alarm? Well, your body would respond to that alarm the same way if there was an actual threat, such as an intruder. So with OCD, it takes over your body's alarm system, a system that should be there to protect you. But instead of only warning you of real danger, that alarm system begins to respond to any trigger, no matter how small, as an absolute terrifying catastrophic threat. So the bottom line is that in order to reduce your anxiety and your obsessions, you have to make a decision to stop the compulsive behaviors. And that's the real trick to this disease. So in the case with these twins that I shared on my part 1 video, they were so severe with OCD that at times they would rarely leave their house. Day in, day out, these twins, they couldn't handle it. And as a result, they had a pact, and they committed suicide at a rest stop in Broomfield, Colorado. What a tragedy that these girls felt that much hopelessness and didn't see their way through the darkness and the fear of this disorder. So what are these different types of OCD? Well, before we talk about the types, I want you to imagine that you're experiencing some OCD symptoms, and maybe you have, maybe you haven't. But let's say that you have for the first time, and you know something is wrong because you're feeling much more anxious than you usually do. And you have these thoughts that will not go away. Maybe you're having trouble sleeping, or your mind is constantly overwhelmed by thoughts that seem to run in a never-ending loop. And you're really not sure if you should risk telling your doctor that you lie awake at night repeating mantras and mentally reviewing whether or not you actually locked the door of your apartment because, oh, heaven forbid, what will he think of me? He'll think that I'm strange or I have problems. Or maybe that you shouldn't share with them your intensely disturbing thoughts that you keep having about hurting your toddler son. Oh, maybe he'll think I'm a horrible mother. And so you can see the dilemma here, where a lot of people do not report their intrusive thoughts to doctors just out of fear of what will that doctor think about me. And they don't share it with many people privately because they're too afraid to, of what will that person think of me. So they're really having to carry this burden on their shoulders alone. And that becomes almost overwhelming and at times too much for people. Another scenario might be, well, you finally decide to go to the doctor. So you arrive at the doctor's office, you feel almost unbearably nervous. A nurse comes in to check your vitals, which feels a little strange since your symptoms aren't primarily physical. Then the doctor comes in surprised to see you. Back so soon after your recent appointment, you tell him everything you've written down, and you have bullet points to go through, which allows you to get through the worst part. So these might be some things that you might share with your doctor. These are the typical common obsessions that most people have if they're experiencing OCD. They have themes, And really, if we take the word fear, it all boils down to fears, different types of fears. You can see that their fears are truly false evidence appearing real. And that's what happens with the brain. You can see that it's so focused on the fear, then it creates the anxiety. It's traumatic. You avoid things. You might have flashbacks. Your life is filled with risk. And you can see how it's all consuming to one's mind, and it can affect one's physical health too. Well, let's talk about some different themes that maybe someone with OCD might have. They might have a fear of germs or dirt. What are the symptoms if they have this? You might be scared to touch things or touch things that people have touched, like doorknobs, or you don't want to hug or shake hands with others. Now, this one here might be flared up for most of us because of COVID-19. We know how deadly that virus has been. And so, yeah, I think for a lot of people right now, this has probably been an overwhelming fear of trying to avoid any kind of viruses, bacteriums that would cause extreme health risks. Another theme might be feeling a fear of hurting yourself or someone else. The symptoms would be when you're thinking of something completely different, you have thoughts about hurting yourself or someone else. These you can see are related to different house themes that we do at our home. Maybe you're one of those, and some of these we do, and because it's not an intrusive thought or it's reoccurring all day long, we might just have these obsessive compulsive behaviors. Maybe when it's time to leave for work each day, maybe you check repeatedly, or at bedtime, to make sure your kitchen appliances are turned off or the door is locked when you leave. Another one is collecting or hoarding. What does that look like? Well, the symptom would be your home is full of things you don't use or need, and you can't stop yourself from buying more. Oh, it's on sale, I've got to buy it. These repetitive routines usually don't have anything to do with the obsession you're trying to fix, and can take hours to do. So, what is the diagnosis for individuals that are suffering these themes and these symptoms in a severe way, where they've completely lost control of their life because of these obsessions and compulsions? Well, the diagnosis, if you think you might have OCD, the recommendation is to see a doctor or a psychiatrist. The diagnosis process will likely include a physical exam to see if your symptoms are due to a health condition. So they're going to rule some things out. They'll do a blood test to check your blood count. How is your thyroid working? And any drugs or alcohol in your system that might be impairing you and causing maybe some delusions and those kind of things too. Some of the real critical ones that people tend to have with obsessive compulsive disorder would be the body dysmorphic disorder. And body dysmorphic disorder is characterized by a persistent thought that one's body is flawed or ugly. These negative thoughts, like OCD, can cause severe emotional distress and problems in daily functioning. The disorder is also often characterized by certain repetitive behaviors similar to OCD, including the skin picking, excessive grooming, and excessive exercising. So this isn't where you look at yourself one day and your pants are tight and you say, oh, I'm putting on weight, I've got to go on a diet. No, these are situations that's an ongoing thing every day. They're fixated in the mirror. It's almost like they can't leave their bathroom. They're fixated maybe on their face or their legs or their arms. And when they look at themselves as a whole, they might see themselves not as they truly are. So if you know someone that's suffering from this would need to be, in order to overcome this, you would need to seek some professional care in helping you through this. Another one that maybe you or others are dealing with that you know would be relationship problems due to their OCD issues. So the co-occurrence of OCD and social anxiety can also affect an individual's relationships, including dating and marriage. And it's so-called relationship. So it actually has a title. It's called Relationship OCD. And this is characterized by persistent thoughts of doubt about one's partner or even oneself. These can be related to levels of attraction and questions of worthiness of being with a certain individual. These kinds of persistent thoughts have the capacity to harm a relationship if untreated. And sometimes it's almost like you get so far into a relationship and then you naturally sabotage it before you can get hurt by someone, so that they don't see your flaws. It's kind of a control issue that way a little bit too. And again, you would want to seek some professional guidance on this so that eventually you can have a healthy dating relationship and a successful marriage, which everybody, is deserving to have. So why is OCD so often misdiagnosed? You can read through this, but I'm going to just kind of go to this highlighted area here. It says, as Dr. Jill Feska, MD, explains in Physicians Weekly, OCD is so often underdiagnosed and undertreated, not only because people with OCD are often secretive about their symptoms, but also because, quote, a lack of recognition of OCD symptoms by physicians often leads to a long delay in diagnosis and treatment. End of quote. So it's just that some doctors are not really maybe aware of how to diagnose or how to recognize those symptoms of OCD. And so let's say that you have OCD or you know someone with OCD, what should you do? Are there treatments? And the answer is, of course, yes. So your family member, friend, or yourself would go get what's called CBT or ERT therapy. And also it's recommended that they're on specific antidepressants. So CBT is a form of talking therapy. So CBT is cognitive behavioral therapy, and it's where you go and you would talk with your therapist. Unlike other talking therapies like counseling, it's more structured and tailored around the individual's here and now problems, and it rarely focuses on the patient's past. It's also meant to be short-term therapy, lasting weeks and months rather than years. Research has shown that in this particular type of therapy, 75% of the people with OCD are significantly helped by cognitive behavioral therapy with some local services. Reporting the rates up to 80%. So yes, there's hope, lots of hope. If you find the right therapist and the right treatment plan, yes, you're going to be able to overcome this and continuously overcome the different maybe compulsions and obsessions that maybe are triggered throughout your life. Another type of therapy that has a high success rate is called the exposure therapy in ERP, which refers to exposing yourself to thoughts, images, objects, and situations that make you anxious and or start your obsessions. While the response prevention part of ERP refers to making a choice not to do a compulsive behavior once the anxiety or obsessions have begun triggered, all of this is done under the guidance of a therapist at the beginning, though you will eventually learn to do your own ERP exercises to help manage your symptoms. So it's nice because the therapist is going to teach you the technique to help yourself, which I love. And it says, that said, this strategy of purposefully exposing yourself to things that make you anxious may not sound quite right to you. If you do have OCD, you have probably tried to confront your obsessions and anxiety many times only to see your anxiety skyrocket. With ERP, the difference is that when you make the choice to confront your anxiety and obsessions, you must also make a commitment not to give in and engage in the compulsive behavior. When you don't do the compulsive behaviors, over time, you will actually feel a drop in your anxiety level, the natural drop in anxiety that happens when you stay exposed and prevent the compulsive response is called habituation. So that's the goal for all of us out there with OCD. It's to get it under control and get the responses to a point of habituation quickly. Do we have depression when we have OCD? And you'll find too, a lot of people that are struggling with OCD do feel hopelessness and some depression. An awareness of one's OCD and time spent trapped in certain behaviors and rituals can lead to a perceptible decline in quality of life, which can lead to depression. It makes sense, doesn't it, that there would be a correlation between depression and OCD. Well, if a person is so hopeless, feeling hopeless, like our twins at the beginning of my lesson, yeah, there is a risk of suicide. And these suicidal thoughts are also more common among those living with OCD. Quote, it can become so debilitating that people think that death may be their only salvation, their only escape from the distress, says Dr. Storch. We tend to see that as severity increases, the more severe someone is, which often coincides with not responding to intervention, the more likely they are to start thinking about suicide, he added. So we talked about, hopefully nobody gets to this level, hopefully through meeting the correct therapist, undergoing the right therapy for you or your friends, and then being on the right antidepressants, which are those SSRIs, which would be, this is just a variety of ones that have worked for people with OCD. Maybe you're familiar with Prozac or the Paxil, and these are some other newer ones that you can see are for certain ages. Okay, so here at the tail end of this lesson, I just wanted to kind of review some things and go over just a couple more things with you. Because of OCD is often paired with another mental illness like depression, some OCD sufferers are at risk of suicide. We talked about this. New studies suggest that OCD sufferers are 10 times more likely to commit suicide or display suicidal thoughts and behavior. If that is you, ask for help. You don't want to be out in stormy water by yourself without any kind of support from others. You need to get a life raft out to you. You need to wait. And these are the things that they recommend at the suicide prevention of their, basically encourage them to talk to others. It's not something that they can do alone. Unfortunately, receiving an accurate diagnosis of OCD takes 9 years on average. It can take another 17 years to receive sufficient care. Still, with the right treatment, only 10% of people with OCD completely recover. I talked about some different treatments that work that are from the family of SSRI medications, which are antidepressants. And, how many people really are dealing with this? It says our best estimates hold that about 1 in 100 adults, or between 2 to 3 million adults in the United States, currently have OCD. This is roughly the same number of people living in the city of Houston, Texas. What about kids? Well, there are at least 1 in 200, or about 500,000 kids and teens that have OCD. This is about the same number of kids who have diabetes. That means 4 or 5 kids with OCD are likely to be enrolled in any average-sized elementary school. In a medium to large high school, there could be 20 students struggling with the challenging causes of OCD. Well, it's almost our time to say goodbye. I just wanted to let you know that I have hope. I have hope for a brighter future for you, for me, for our dear loved ones, and for humanity as a whole, for all of our friends all over the world, that I have hope that we can face this together. And I wanted to give us a quick reminder, to go back and restate some of those important things that were discussed in this lesson. And some of the most important things to remember, that we don't need to let our fears control us, that we truly can face our fears and overcome them, and that we can have the power to do that if we work with a trained therapist that can help to meet our needs, that can work well with us. And if we are on a antidepressant SSRI prescription that works well with our system, then we'll be able to better face our fears, and that we can learn and have confidence within ourselves as we work with a therapist, that they can help to train us how to stop those lies, how we can reprogram our thought process and see things as I could, I will, I wish, and not let those fears drive us into dark places in our lives where we get hopeless. Another thing I wanted to remind us about, that I love to speak about, is to always have an attitude of gratitude. And that will help to brighten your day also. And try to serve others. Sometimes it seems like when we are out helping others, sometimes we forget about ourselves and those struggles that we're having personally. And so I would encourage you to try to think of at least 3 things you're thankful for each day, and try to do something to help someone out. At least, just one little thing each day could help you a million times more than you could even imagine. And last but not least, I wanted to send you some love and some hope for you, for your loved ones, for those important to you in your life, to help encourage them to have a voice of hope, and that we can be optimistic for each other's recovery from this trying disorder, this discouraging disorder at times, the obsessive compulsive disorder, and that we'll have the power not to fixate on those lies, but we'll have the power to wish for a bright future and to be ready to see beautiful things happen in our lives, and that we will have the desire and the willingness to move forward every day with hope and happiness. That is my wish for you today and every day. And until next time, friends, bye-bye.